Hello guys, welcome to today's video. And the aim of today's video is going to be discussing what I hoped 8-9 months ago that somebody would have told me and guided me with the whole study process. Now, to introduce myself, my name is Dr. Wakas, and I'm a recent graduate from Ivanija Vocational University in Tbilisi. And I graduated last year in 2025 in August, and I've been studying since then for the AMC exam. And however, due to some miscalculations and scheduling on my end and the recent situation in the world right now, my exam just kept on getting delayed. So even right now, my exam was supposed to be this month in March. However, it has been delayed again by another month. So I've been preparing for this exam for about 8 months now. However, I believe that having 3 months of preparation is just enough, is the ideal time for a student or a full-time working doctor to be able to pass this exam, especially the new pattern and the new changes that they're making in April. And that has been hinted towards in their AMC's website, that the pattern and the caliber of the exam is going to be changed. And basically, when we study for the AMC right now, the AMC is not going to ask what you already know, especially if you've just recently graduated from the university. Because most of us coming from the universities have that mindset that, okay, I can study for the the MCQs from the past exams, or I can study what the professor is teaching and the lectures and I can pass. However, that is not true anymore for the AMC exam because right now the AMC is not going to test what you know, but it's going to ask what an Australian intern should know. Because this AMC exam is not, a normal MCQ exam that we used to give in the university. It's a professional exam, and one of the advantages for doing the AMC or choosing the AMC route is that a student can then apply and become part of the Australian healthcare system right after the AMC Step 1 exam. However, that also entails that whatever you study, whatever education you gain, whatever practicing, whatever knowledge you have should be on par with an intern doctor that's already in Australia or that's ready to join the Australian hospital or the healthcare system. And right now, I want all of you to have this mindset. Every time you approach one question, I want you to think not as a medical student or just as somebody on the sideline or an observer, because that was the mistake I was making in the first few weeks. I want you to imagine yourself as the doctor that's on that case right now. I want you to imagine the setting that the patient comes to you in. It can be an emergency room, it can be a GP clinic, it can be a trauma center, because later on when we'll be doing the lectures and you'll be seeing those questions, the setting that the patient comes you in makes a huge difference to the care that the person can receive. Because sometimes some interventions are possible in a GP clinic. However, for some, if the patient approaches in a GP clinic, it's better to refer them to an emergency center or a specialist center. However, we'll be going over those later when those lectures come around. And, if you want to stay around and wait for those lectures, you can subscribe to that channel. In the coming days, I'll also be sharing the lectures that, the ones I studied from, the notes I've made, and the extra tips and tricks that I used to, understand those lectures better. However, let's move on to the first step. So the first step is that, as I said earlier, that it's supposed to be a 12-week plan. However, it's not essential that you do it for 12 weeks. I've seen doctors that have passed after 54 days of studying, which is a little bit less than 2 months. And I've seen doctors that have spent 6 months trying to pass this exam but have continuously failed even on the third attempts. So I don't want you to stick that the number of days that I prepare is going to make me pass the exam. However, I want you to think is that the better preparation I have, the more ready I am to deduce those cases, the diagnosis, the differentials, and what is the next step and the best step. Then, inshallah, I can pass that exam and mark the right answer on that MCQ questions. Now, you may have seen, John Murtagh being tossed around. So the study plan is divided into two basic plans, the theory and the recalls. The theory is all of the reading material that there is. So the most famous would be, I think you've already seen, John Murtagh 9th edition. The 10th edition is still not out yet, so 9th edition is what you're following. Then I would say Kaplan Step 2 CK, because that's one of the books that I read in the early days. I'll go over those books that I find that that gives better yield of knowledge, because that will be more applicable to what the AMC is going to ask about. as compared to books such as, you know, the big books they used to study in medicine university, like the Harrison's book or the Davidson's internal medicine. Those are really good books, you know, don't get me wrong, that the knowledge is, you know, out of this world in those books. However, you need to manage your time efficiently right now, because when you book the exam date, you have a limited number of days before you get prepared for it, and you need to have a strong mindset for it. So John Murtagh, Kaplan Step 2 CK. And number 3 are the lectures. Now lectures right now, there are not, I haven't come across any free lectures on YouTube. That's the aim of making this channel, so that I can share this lectures with you freely. You can access them anytime. However, at the end, I'll also share another, I have a folder that has all of my notes, all of my past questions, all of the recalls that I've done, my question banks, all of them are in there, and you can buy those off of me, and you don't have to wait for those videos to come out, all right? So, John Murtagh, Kaplan Step 2 CK, and lectures. In this, I would say lectures from I would say courses that are already available, they are good. However, they're very expensive, such as the emergency focus group. They charge 1,600 Australian dollars for, I believe it's a 2-month course. However, their lectures are really good, because I've had friends who enrolled into those, and they shared some of the clips with me, and they're very nice. If you think that, you know, that's a good way to spend 1,600 Australian dollars and get that course, I would really highly suggest that. And on top of that, you also get CPD and CME hours from those courses, which I think would make it worth it. However, the mistake I made was that I planned my exam before I had finished my EPIC verification, before I had done my ID verification, and before I had submitted my diploma or my degree for attestations. So if you want to watch how long that's going to take, or how many days you should keep, you should go check out the last video. Alright, now moving to the 12-week study plan, I would say that at the beginning of your study journey, it's better that you reserve an exam seat maybe 2 to 3 months in advance, because that way you'll have an exam deadline in your mind, and you can focus on your exam more seriously. Because if you don't have a deadline, you won't really, think about the exam seriously. And before we start, I also want to put in the step that don't take this exam as a stressful part of your life. If you take if it's something that's stressful in your life, you won't really have fun while doing this exam. So once your exam date is booked, and you're going towards that exam date, that deadline, towards that time you'll have a limited number of days, so you need to use your time very efficiently. So that's why I've made this list of topics, list of materials that you can use, that is going to make your time be spent more efficiently. Now this is for a 12 weeks plan, which is about 3 months, right? However, if you have more time than 3 months, let's say maybe 6 months, or you're still in your university right now, then I would suggest that you start off with reading John Murtagh. John Murtagh, it's a pretty thick book. However, you don't need to read every single topic. I'll also be going over all of the specialities. Where do you start? What's more important? What specialty requires more time, but it's not very how do I put it? It doesn't have very high yield questions, or you won't receive a lot of questions from them. And some topics that are very small, but you will receive at least 1 or 2 questions from those. So it's more wise to spend more time on those questions, on those topics. Sorry. Now I've listed Kaplan to Step 2 CK as well, because this was one of the books I did in the initial days, which was it wasn't a very wise decision. However, it does have very good basic knowledge. It's a very short book, and if you're forgetting few of the topics, then it's a very good book that you can just go over and revise those topics as well. Now, John Murtagh, 9th edition. It's a big book with all the topics, and if you have time, go over those topics. That's good. However, I would suggest a better way would be that you do the recalls and the handbook questions first, because that way you'll know what topics are there, how do they ask the questions, how you would what knowledge you need to have to answer those questions. And then if you still have a few questions after reading the explanations on those websites, or on the explanation the question banks have given, then you can go to John Murtagh's 9th edition and do a little bit more of reading on that. However, in the past, I would say 8 months, I've opened John Murtagh maybe just 2 times, because all of the material that's out there for the question banks, for the recalls, and also in the AMC handbook, it's very good with their explanations and the guidelines that they provide. Now that brings me to another point in this video, is that later on we'll also be discussing, I'll also put it in the description of this video, that what type of guidelines you need to know, and how do you access them, or where should you be accessing them from? Alright, so the Kaplan Step 2 CK, how long did it take for me to do it? Now, at this time, I was dedicating huge chunks from one day to studying those topics, to working towards passing that AMC exam. And mentally, I thought if I finished Step 2 CK, and if I did just the AMC handbook, I should be good enough. That was naive thinking at that time. Later on, I saw more reviews. I understood more. That's just the basic knowledge, and it's not even the complete basic knowledge. So Kaplan Step 2 CK, if you decide to do it, it takes about 1 month to finish the whole book from cover to cover. This is what I did. I covered all of the systems. There are systems that are very big, such as the cardio system, the pulmonary system, the OBGYN system. However, the topics that they're very concise, and it's a good revision. If you have time, just go through them. And however, it's not essential for your AMC to pass, because you can get the same knowledge if you do question banks, if you do eMedicine, and if you do the AMC handbook. So coming to the lectures that there are available. So as I said earlier, that Emergency Focus has one, AMC Mastery I think has a few courses as well. And I believe I attended this online conference with one of the doctors that were offering lectures. However, that they were charging an obscene amount of money. They were charging 5,000 Australian dollar to pass the AMC Step 1. And the catch, they had a few catches here and there for it. However, I would say if you have enough time, and then buying a course is not it's not essential. However, it is recommended if you feel really lost. And again, that's why I'm making these videos, so that you don't feel lost, or you'll understand where should I study from, what should I not study, what topics are important, and so on. And that that brings me back to my Kaplan Step 2 CK point, is that Kaplan Step 2 CK, as the name suggests, is more focused towards USMLE Step 2 CK. So all of the topics that are stated in Step 2 CK are not essential. However, they do give you a basic knowledge of what's important. So if you are, you're completely lost, then yeah, you can go ahead and read this if you have a month. However, Step 2 CK doesn't give all of the topics that AMC asks about, and all of the topics given in Step 2 CK are not always asked in the AMC. And I'll also be providing a list after this video into the WhatsApp group chat that shows all of the topics that the AMC has asked in the past, what's more important, what's high yield. And I'll also be sharing a few tables, few pictures that make things easier for me to also remember and understand through my journey. Now, coming on to the recalls, I would say that the main body of your preparation should be these recalls, right? Because recalls not only give you an understanding of what the questions are going to be about, they're also going to tell you about how do you answer those questions. And what do I mean by how do you answer? So in some of the questions, I don't know if you already know that how they ask in AMC. I'll just open up one of those past papers that I have right now from AMC Mastery. So if you go over here, you can see that in this question, that the last line of that question is asking about which deficiency is most likely, right? They're asking about which is the most highest percentage prevalence in this type of presentation. And in another question, I would say that, let me see if I can find any, so there we go, this question. What is the most appropriate initial management? They're not asking about what's the best management, they're asking about what's the best initial management. So basically the next best step, or the best diagnosis, best diagnostic step, or what step is going to make you confirm a diagnosis. So there are these two different points. One of them is going to be what's the best next step, whereas the other one is what's the gold standard of that diagnosis. So when you go over these AMC recalls, AMC handbook questions, then they'll make you understand, okay, what should I be paying attention towards, what's the trap that I can fall into, and how do I overcome that confusion. Now, as I shared with you the recalls from exam month, I'll just go over them quickly. Those are the recalls from your exam month. So from what I've seen in the past, I've read on forums, it's wise for you to study the recalls from a few days before your exam. For example, let's say if your exam is on the 20th of March, so finish your recalls from 17, 18, 19, right? Because from all of the posts I've read, from all of the forums I've seen, they always say that few of the questions, they were complete repeats from the past questions, and some questions were completely same. However, one or two words were different, or the answer was in the question was in the answer, so they twist the sentences here and there, All right. So if you want to get the recalls as well, I'll share at the end that if you want to buy them off of me, I have them available, and I can make a full pack. I've made a full Google Drive for all of them. All right. Now it brings me to my the very important part of this video, the AMC handbook. Now the AMC handbook is one of the most important books you'll study. Firstly, it's a very old book. I'll see. I think I have it in my drive right here. So the AMC handbook. So the reason I have multiple of this, I'll come back to that later. However, the AMC handbook, it's one of the most important books you'll study. So as you can see, it's a pretty old book. However, the questions that are in the AMC handbook, at least 5, I've seen, five, sometimes 5 to 7 questions, 10 to 11 questions. They take them exactly, completely the same from AMC handbook. Like they just take the whole question and you'll get the same question in your exam. So that's a guaranteed 10 to 11 marks. And I would highly recommend that you not only go over this book once, but you memorize it completely. And 2 weeks before your exam, go over it again. Maybe a few days before your exam, go over it again. The thing is, it's not just that you'll get more marks. You'll also save time, because once you see that exact same question, what your brain is going to do is automatically going to mark that mark the correct answer, and you know for a fact that you have marked it correctly. And why it's important with the mark is that there are a total of 150 questions. However, the examiners are going to be out of 500 marks, and you need at least 251 to pass the exam. And the time limit for it is 210 minutes. So your time limit per question is very limited. It's it's less than 2 minutes. So you need to finish each question quickly with the correct answer. Some of these questions, like you can see, it's a 2-paragraph question, which is relatively shorter. There are a few questions that are very long with lab studies, with the electrolyte level, the protein level, and everything. You have to go over the whole CBC again, the CBC of the patient to make a diagnosis. So if you have a question that's long and it's directly out of handbook, then you can save a lot of time, maybe 5-6 minutes here and there with the other question, and you can use it towards more difficult questions that are relatively new to you. So going over a handbook without a question, you need to do it at least 4 or 5 times, all right, that you can memorize it. I've done it 3 times right now. And the thing is that AMC handbook has a total of, I think, let me take my pen here, that it has a total of 418 questions, all right, and around 150 of those are 150 more on the it has a mock exam page. So the 418 question, what you can do is you can finish it off in 3 days. This is after you've marked all of the question and gone over it once. Because if you're doing it the first time, then the first time is going to take you maybe 2 to 3 weeks. That's reading every single question, reading every answer, and reading the explanation. However, I would suggest just read the paragraph of the explanation that shows why that one answer is correct. Because as I said, that the handbook is a very old book, and the guidelines it uses are they don't apply anymore. So you can't use the algorithm that are stated in the AMC handbook to solve those newer questions. However, the answers that are marked right in the AMC handbook are always going to be right in the AMC 1 exam as well for those questions. All right. So the first time when I did AMC handbook, it took me 2 to 3 weeks to solve those questions, mark them, and give make small notes on every single question. Making small notes on every single question is very important, because when you come back to it and you go over through those questions again, it's going to be very easy for you, and you can finish them in 3 days. And I said there are 150 and 418 questions. However, if you finish 150 questions per day, you can finish these 418 questions in 3 days. That's it. It's pretty easy. And one more thing I would like to highlight is that you can't just jump in and finish 150 questions in 1 day. You'll have to slowly build your stamina towards solving those questions. So the way I started is that I started with 30 questions per day, right? And that slowly moved up to 50 on the next day, then slowly to 75, then to 100, and then finally to 150, all right? And that's, I would say, is essential, because you need to build that stamina of solving questions and being mentally occupied and focused as the days are going towards your exam. Because once you go and sit for your exam, you don't have any other option to sit and solve those questions. Your mind will try to wander here and there, and you need to have that stamina to control yourself and focus on the questions, because it's just 210 minutes. You need to focus completely to be able to get the maximum marks, because as you already saw in the last video how expensive that exam process is, and paying for the exam, it's not easy for most students. So if you have paid for it. So you need to focus, and it's like building a muscle as well for focusing and to answering those question in those 2 month time. All right, so AMC handbook, very important. Revise it at least 5 to 6 times before your exam. All right. Now, coming to the different question banks that are available, I would say that eMedici is the most important one. The AMC exam question bank from eMedici is the most important one, because I've seen in groups as well where students say that they took the exam question from the eMedici's AMC exam questions. However, the eMedici exam questions, if I remember correctly, it's around 228 questions. That's it. You get about 200 questions. That's it from the AMC eMedici. And one more thing is that eMedici AMC also picks up questions directly from the AMC handbook. And I've seen, when I was answering them myself, so I've completed the eMedici AMC a few days ago, and I would say maybe 10 to 15 questions were directly picked up from the AMC handbook. Now, eMedici also has another section for eMedici, I think clinical MCQs. Those are around 4,000. Though it has 4,000 questions in them, and they are more medically clinically phased, like how AMC asks those questions. However, I've seen that I have that membership as well, and I've answered about 2,000, close to 2,000 of those questions right now. But the problem with those questions is that they're not in line of what AMC usually asks, as in the topics are sometimes newer, and the stem of the question is not complete sometimes, because AMC is going to give you the complete information that you need to make the diagnosis. However, in the eMedici, the clinical MCQ, I've seen that there are a few points of information that they leave it up to the student to think about, or just to have it as a differential to answer that question. Instead, I would suggest for you to go for MEDX. The MEDX question, it's a very good it's a very good question bank, and I'll show you right here. I have my OBGYN open right here. So you see the questions are similar to what eMedici AMC questions are and what the AMC asks in the exam, and those MEDX has a very good explanation with guidelines for all of those questions, and you can see that where they took their references from. So it says Medscape from here, and sometimes they take from Up to Date, sometimes they take from the RACGP guidelines, which you need to follow for the exam. And at the end, I'll if you're interested to get those the AMEDX questions as well, I can also add those to the Google Drive link. Now, so this is the 3 month plan. So if you have a month, spend it on to read GM and Kaplan, but focus on AMC handbook. It's going to take you about 1 month to finish AMC handbook. Then move on to the question banks. All right, from AMC handbook, we're moving to the question banks. Whatever you do not understand from the question banks and the explanation, we take it towards John Murtagh. Don't read the whole topic, just read the paragraph from the topic that you don't understand. All right. Now, after, so let's say all of this going through is going to take you about 3 months, right? The AMC handbook, the question bank, John Murtagh. And one more essential thing I want you to consider is RACGP guidelines. Those are the most essential guidelines, and as people call it, the red book. So AMC handbook is the blue book, and RSCGP is the red book for guidelines. Now for the so there's RSCGP, there's also the pediatrics guideline, there's also the diabetes guideline, there's also the anticoagulation guideline. I'll go over those in a different video, because I think it's a very big topic and deserves its own video. However, these are guidelines, and you need to, I would say, in the last 2 weeks, along with your revision, just read these guidelines and make your own notes, because those algorithms are very long and they're very confusing. So if you put them in your own words, in your own tables, then it's going to make things very, very easy. And that brings me to my second most essential thing, is that to make extra notes with tables and your own pictures. Now, just to give you an example, I've made this table. This is my own table that I've made. and it's from the February recall, whatever pathology they asked. And right now for the guidelines, whichever is the antibiotic, that's the first line antibiotic. All right. And antibiotics, AMC loves antibiotics, and they will ask you a lot of questions from the first line antibiotic, the second line antibiotic. Let's like right here we have UTI in pregnancy in the second trimester. Now that's different than UTI in a child, and UTI in the first in pregnancy in the first trimester, and that's different than a UTI in an adult. So if you have a table like this, you can compare all of this and remember them. So this table has the key features, what's going to look like, and all of these important antibiotics. I'm sharing this table in the WhatsApp group, so if you want to join the WhatsApp group and look at this table yourself, just save it. The link for the WhatsApp group is in the description below. All right, so yeah, having your own tables, having your own notes, it makes a huge difference. And another important point is that you need to have a study partner also as well with you. If you have a study group, excellent. You need to have a study partner who's also, if not as motivated, but more motivated than you, because that way they'll keep a check on you, you'll keep a check on them. They'll annoy you to the point that you'll want to study more and outdo yourself. Alhamdulillah has not been the case with me, because the stress of the studies is enough to drive me. However, having a study partner makes things easier, because you guys can cover multiple topics easily, and you can have notes from different point of views. Maybe you miss something and they see it, or they miss something and you see it. So right now I've these notes that have been made from one of my study partners, and what they did was that we'll just go to the beginning. So you can see that each different syndrome is just one line. You see, it's a very short note. So this is excellent for revision. So when it comes to the last week before your exam, or 2 to 3 days before your exam, or while you're solving the recalls from your exam, then you just read through those. If you have any confusion, just go through them, and it clears your confusion. And again, remember, these notes are not for you to study everything from the beginning. These are just there with the most important high yield points, so that if you forget something, you can just review it and remember it that time. And if you want, I can also include these in the Google Drive link. However, there is going to be a charge associated with this Google Drive, and I'll discuss this at the later at the end. And if you're looking for a free option, you can just subscribe to this channel, because in the coming days I'll be going over each lecture, going over each topic, so that you'll have what's the theory to cover, what are the important points that you should consider, and what topic you should read. But if you are in a hurry and you need those notes, you need those lectures ASAP, then it's better for you to get that Google Drive as well. Now moving on to the third point, which is the important topics. As I hinted towards that at the beginning of the video, that there are a total of around 22 to 24 topics, as I remember, but not all topics are very important, and not all big topics have a lot of questions asked from them. All right, so the big topics that there are cardiology, respiratory, which is pulmonology, rheumatology, pediatrics, then we have neurology, and OBGYN, and GI. Now these are the topics that are the biggest. However, GI is the most important, and so is OBGYN, because those two have the most questions asked from them. You would expect that cardiology would be really important. However, cardiology is not just one sole topic, because cardiology has a lot of overlapping with pulmonology, with PEs, with DVTs, with right-sided failure, with hemoptysis, and hemoptysis again is also going to be linked with GI as well. So cardiology has a lot of material. However, the questions asked from them are not a lot. So covering your ECGs, covering all of your basic medications, covering your aortic dissections, covering BPs, preeclampsia, eclampsia, those are very important topics. However, they're not sole cardiology. So I would suggest just have go through cardiology in the beginning once, right? The ECGs are very important. The ACLS, BLS, and the guidelines for CPR, those are very important. All right, so you need to know those according to the Australian guideline, not according to the international guideline, but the Australian guideline. It's not very different, but it has a few differences in the dosages and the time period, so just have a look at them. All right, so cardiology is important, but it's big, but it's not as important as gynecology and GI, because a lot of questions come from OBGYN topic and GI, especially the obstructions, the cancers, the achalazias. In OBGYN we have PP-ROM, PROM, we have missed pills, we have different kinds of bleedings, ovarian torsions, ovarian cancers. So all of those are very important. So I suggest you start with OBGYN and GI first. Then you can go over the other topics. Now the way you go over the topics, that's these topics are divided into big topics and small topics. So I would suggest in one day you either do one big and one small, or you do three small topics. Now the other topics, the ENT, hematology, ophthalmology, traumatology, infectious, psychology, oncology, these are very small topics. However, they have a high yield of the questions that come from those small topics as well. So going towards the other smaller topics such as hematology, rheumatology, ENT. So the idea is that these are, although they are smaller topics, they have smaller amount of portion to cover as compared to cardiology, respiratory, or pediatrics. They, however, have a lot of questions related to them that are from their own, purely hematology or purely rheumatology. Or sometimes the topics are going to overlap, such as, as I said, that PE is going to be both your respiratory, it's going to be both cardiology, respiratory, such as, pulmonology. And another important one is going to be trauma related. So in trauma, you're going to have pneumothorax, hemothorax, then the whole algorithm of how do you treat it, how much percentage of hemothorax should be there for there to be an intubation, and where do you do pulmonary centesis with a needle instead of using, let's say, a pipe to drain the a tube to drain the hemothorax or to drain the pneumothorax, and how do you check for it, what's the gold standard, what are the initial steps. So there are overlaps, and the overlap is also seen in neurology, we have here, and then we also see that in emergency and also in traumatology, if I can find it. So traumatology, emergency, and neurology would be related in the way where a person has an open compound fracture or a posterior shoulder dislocation, a knee fracture, an ACL tear, posterior ligament tear, a popliteal fracture, so a knee fracture. So they'll ask you, in the essence, it's a traumatology case with the fractures. However, they could ask you what's the next step. Do you do an X-ray, or do you do a CT scan? Do you check using an ultrasound one to see if there's septic arthritis? So and thus they're covering radiology, they're covering rheumatology, they're covering neurology, and the fact that they could ask you if there's a loss of sensation. Let's say there's a loss of sensation in the anterior of your palm, the palmar aspect of your interosseous, the thenar muscle. The person cannot pinch anymore. So what nerve is involved in that? Or the person cannot move his hand or grip properly. So what is the nerve that is being involved in that? And that's really seen in a lot of the humeral shaft fractures. So they could ask you a lot of questions that are overlapping for different systems. And again, in the end, I'm going to go over how do you divide your 12-week for preparation, how do you cover each and every step of it, how do you cover all the high yield, how do you cover the low yield topics as well. All right, and for now, one more topic I would like to bring your attention to is ethics and biostats. I've seen a lot of questions come from these. The questions are very direct, especially for biostats. In biostats, they will ask you, if you're supposed to do a case study, if you're supposed to do a double-blind trial, if you're supposed to do a cohort study. So, there are a lot of different questions that could come from biostats. And in the biostats section, in the recent February recalls, I saw them ask questions about forest plots. So forest plots are basically, these kinds of graphs that have triangles in them, diamonds in them, and they ask you if the data is significant or not, what changes should be made, what is the most important aspect of the study. So there are different types of questions from biostats as well as ethics, and they'll ask you those questions directly. So biostats and ethics are smaller topics, but they're high yield and they're easily scoreable because questions are small, you need to spend less time, and they're purely based on memory for biostats. If it's a case study, if it's a double-blind test, if it's a cohort study, it's a retrospective study. And they'll give you a presentation. For example, if you're a junior doctor in a GP clinic, or you're a junior doctor working in a university, and the researchers ask you these questions, or they'll tell you that you're a doctor on an ethics board, and they'll tell you that this company is presenting to you this study or a trial for medicine. How do you make sure that it's the study has been done right, or that the study outcome had a good impact, or the outcome is measurable in the proper way or not? And in ethics is going to be about, person is dying and only their son is there, but the patient said something, the son is saying the opposite. Who do you consult? And also it's going to present on the rape victims or with abortions under 16, under 18. What do you do in that situation? Do you call the parents? Do you go ahead with it? And there are different ways that Australian guidelines deal with it as compared to the US or the USMLE guidelines. So it's different than that. So you need to pay more attention to this, but the portion to cover is very short, so it's a high yield. The possibility of you scoring is high. And then derma is also important because in derma a lot of questions come with the pictures, and if you know what the picture looks like, then you can easily guess the diagnosis, as well as how do you treat it and how do you manage it. Yes, as I was saying that in dermatology they'll give you pictures, and if it's a bulla, if it's a squamous cell carcinoma, if it's a BCC. So they'll ask you, they could ask you what's the diagnosis. They could ask you how do you diagnose it. They could ask you the differentials for it. They could ask you the drug to treat it. They could ask you what is the condition associated with it, especially if it's a squamous cell carcinoma or BCC basal cell carcinoma. All right. Now, oncology is a very short topic, and oncology, I've seen questions from oncology come, under other systems as well. So ovarian cancer, endometrial cancer, endometrial fibrosis, fibroids, and in derma we have SCC, BCC, as I said, and those cover oncology completely. Even in endocrine, we have a thyroid cancer. Do you do a lobectomy, or do you do a partial hemectomy, where do remove half of the thyroid gland? And one more topic is urology and nephrology. So both of them come under the same topic over here. The topics are not very wide. However, I've seen a lot of questions from nephrology, especially for kidney stones. And how do you treat them? Do you do lithotripsy? How do you do differential diagnosis between that and let's say cholelithiasis or cholecystitis or acute pancreatitis? And urology, they could ask you, they could give you so there are different diagnostic tests, and in the coming videos we'll be going over them, such as the translucency test and if there is a cremasteric reflexes or not. So the pathologies for urology are very short. However, if you know how to diagnose it based on the signs that they've given you, or what could be the next step in diagnosing it, then bingo, you've got it. You'll get the mark for this for the urology section as well. All right. And in pediatrics they'll ask you about the vaccination dates. They'll ask you about this kid has been walking, but now he suddenly develops pain in his hip. And those questions are usually the hip development, hip dysplasia, or Perthes diseases. So those come under traumatology as well. However, they also come under pediatrics. So if you can memorize that, then you'll be covering two different topics as well. One, they'll ask you what could be the most likely diagnosis if there is epiphysis dislocation, especially that occurs in teens when they're playing a lot, and then they have high impact sport such as in rugby, and they get tackled and then they develop pain while walking. All right, so one more thing that they'll ask you in pediatrics that could overlap with neurology would be bulimia nervosa. They could ask you about anorexia nervosa. They could also ask you about eating disorders, ADHD. If the child is deaf, what different developmental delays will they have? Then they'll also ask you about parent, if there's parental abuse involved. They could give you some bruises that the child has. How do you how do you go about questioning that this is if it's parental abuse, or if it's a idiopathic thrombocytopenia purpura with those ecchymosis and the purple discoloration on the skin. So you'll have to concentrate on those as well, and later on we'll be discussing in the coming lectures as well. Now, ENT is pretty easy because ENT has maybe just 3-4 pathologies. They're easy to differentiate, however, they're very crucial. Again, I have a table for that, and we will be sharing that in the WhatsApp group. And if you want everything, all the tables, my notes and everything together, I'll let you know at the end of the lecture how do you get it. So ENT is mostly, you diagnose it. The treatment options are not very vast, because at the end you'll have to refer to an ENT specialist. And same for ophthalmology. Ophthalmology is pretty easy as well, as there are not a lot of diseases, pathologies related to it, but it is tricky, especially, if you're looking at the optical tract, if you're looking at, if the person has loss of eyesight in half of the eye, on the left half of both the eyes, or just left and right half of both the eyes, or if there's hemianopia, if there's optosis, yeah. So they'll also ask you about the different nerves that are involved in that, comes both ophthalmology and neurology section. All right, so I'll be sharing a list of all the important topics in each of them that I've done myself, and I've seen in the recent recalls of February as well. All right, so this finishes our third section. Now moving on to the fourth section, it's tips and tricks. All right, so these are important tips and tricks I want you to have, because this will make the preparation a lot easier. And I wished somebody had told me this, 4 or 5 months ago when I was struggling with this. So number one, as I said, is always get a study partner, either who is as motivated or more motivated than you. Number two would be to make tables, because it's very easy to remember, to compare diseases and to see the differences in them. Number three, have short definitions, as I shared the notes with you. So it's easy to, it's not there for you to memorize a new disease, but for you to review the disease that you maybe an aspect that you forgot. Then number four is compare. What do you compare? The different diseases, different pathologies, you'll have to compare so that you can understand what signs and symptoms you would see in a patient group that let's say has labyrinthitis as compared to vestibular neuritis, or Meniere's disease. So that way you can compare, see the different signs and symptoms, and then you can differentiate with them. And number five, this is most important because I realized this later on, which is age grouping. So each disease, especially for oncology, it has an age to it. So who's going to develop colon cancer, breast cancer, ovarian cancer, who's going to have signs and symptoms of rheumatoid arthritis or osteoarthritis. So if you know the age groups of it, you'll already have a few diagnoses in your mind when you start reading the question. And let's see over here, because in most questions they will be giving you an age always. So you see 29-year-old women, 29-year-old women. So same question. We'll go to the previous question over here, and again 37-year-old women. So you see they always give you the age for it, and you'll have to group the age accordingly. All right. Now number six, this is something, this is just a personal tip, is that make your own acronyms, pseudonyms, or ways of memorizing things, because it makes things easier only for you personally, right? So for example, I have this short form of remembering the drugs for UTI, which is give a pregnant women with P problems some relaxation. All right, relaxation and not nitro. All right. Now, what does this mean? I mean, personally, I understand, but for you, if you're reading it for the first time, it does, makes no sense. So, pregnant women with P problem, that's UTI. Some relaxation is cephalexin, because cephalexin sounds like relaxation. And then not nitro. Nitro is nitrofurantoin. Okay. Furantoin. So nitrofurantoin is the first line medication for adult UTIs, but it's the second line medication for pregnant women with UTI. First line is cephalexin, and that's written in this table as well, you see. So UTI in second trimester, nitrofurantoin. That's second trimester, all right. Then in first trimester, we have cephalexin. All right. So in the first trimester, we avoid nitrofurantoin and TMP, and they will ask you this question. They'll give you the age of the patient. They could give you, she presents with the first checkup in the clinic, and she is these many weeks pregnant. She has signs of UTI. All right. It's important to remember we treat UTI in pregnant women and in children, but we don't treat UTI in an older age group that do not have any symptoms. All right. So that's an important distinction to make, and that's something that you should always remember. All right. So again, if you want to read this whole table, it's in the WhatsApp group. To join the WhatsApp group, the link is given in the description of this video. All right. Now coming to fifth and final part of this this video that's going on for so long is, if you want my own notes, my recalls, my lectures, important tables and photos, you can send me a message on WhatsApp. And the thing is that these are not free, because I've paid for them myself. I've made them myself. The notes are from my own study group. The lectures are they're paid lectures. I got the notes from them. I got the lecture PPTs. The tables have been made by me completely. The photos are from all of the different resources that I used. They are photos of, especially for derma, especially for x-rays, how do you differentiate them and how do you recognize them in the first go, the endoscopic pictures and everything. If you want them right now, there's going to be 300 USD. All right, this includes all of this also includes the recalls, the notes, the lectures, important tables and photos. All right, so it's 300 USD. You'll get all of this. I think the value of this is around, like, I think 2000 USD. However, I'm giving it for 300 USD because I understand that's not easy for some people to afford very expensive resources. However, at this point, you are at your professional exams level, right? So you have to think like that, because back in university, a lot of the lectures, a lot of the resources were a lot cheaper. They used to be free, but that was because we are at university level. However, right now you're entering a professional level. So if you're interested in this, you can send me a message. You could send me an email. And if this 300 still seems expensive to you, so what you could do is you could get together maybe 3-4 friends, and they could pitch in and pay this $300, and you can use just one account and share it around. I mean, that's up to you guys, however you would like that, because I know a lot of students that do that. All right, now coming to the closing of this video, if you have 3 months time, right, that's 12 weeks. All right, first month you are going to focus on the AMC handbook, all right, plus the question bank. Now this question bank could be MedX, it could be M+X, it could be eMedices, AMC questions. All right, and after this, when you're doing these and you find a topic that's difficult for you to understand, you refer to John Murtagh, all right, or to any up to date, or you can even use MSD Pro. If you don't know, MSD Pro is an app that you can use on your devices, your laptops, or you could use on your tablet, your phone. It's it's a compact app that explains really well for diseases. However, it goes beyond the scope of AMC sometimes, and sometimes it doesn't include the guidelines that are within AMC. So I would suggest, if you don't understand, just go with John Murtagh. All right, now in the second month you want to do recalls. You want to do at least 6 months plus last year's same month recalls. And again, if you're looking for recalls, they are included in this $300. Yeah, MedX, M+X, and eMedici AMC questions, they're also included in this. All right, now in the last 3 months, you're going to divide into 2 weeks plus 2 weeks. All right, so that's 4 weeks. Now in the first 2 weeks, you're going to revise your AMC handbook. All right, again, so you're going to revise your AMC handbook, plus do recalls again, plus you start doing mocks, full length mocks, so 150 questions and for 210 minutes. And you can find mock exams on the eMedici AMC page, or you can even make your own your own style of mocks. You could take all of these recall questions, put them into ChatGPT or AI, and tell them that just shuffle them around and give you questions with 5 options to solve, and you can time your own self. All right, so AMC recalls plus mocks, AMC handbook plus recalls plus mocks, plus you wanna revise your notes. All right, again, if you want my notes, they're also included in the 300. However, it's important for you to also make your own short form notes that you understand. All right, and the last 2 weeks, you're going to revise AMC handbook once more. So the final time you're revising AMC handbook, and then you're going to go over the weak areas of your mock exam. So every time you do a mock, you see what mistakes you're making, and you want to correct those mistakes and go over those areas again. All right, that makes sure that you don't repeat the same mistake. It's all right to make a lot of mistakes before your exam, but not in your exam. All right, you have 12 weeks to prepare for it. You shouldn't be making those same mistakes again. All right, and then finally, again, you do mocks and then recalls of that week as well, and then go over your notes again and keep on going on. Now, 1 to 2 days before your exam, don't do anything, just relax, just have a good night's sleep, don't think about the exam, and go into the exam hall with good sleep, with a relaxed mental status, and just try to have fun if you can with answering these the questions. So that's my guide that I'm sticking to, that I'm using, and it's helping me a lot, just to stay focused and stay to my schedule. So if you have any questions that you would like me to address, you would like me to find the answers for them on the forum, just put them in the comment section below, or if you want, you can send them into the WhatsApp group as well, and I'll be sure to go through them and answer as well. Hope you enjoyed this video, and hope this helps you start with your AMC journey as well. Thank you.